morning after a week's rain. Hopefully the center attains its target, what is being aimed at now. I think it's a difficult task. It's not as easy as we all think. First, I appreciate the name Drona, great teacher. We're all teachers, and at the same time we're all students too. We teach on one side and then we learn from the other side. Only in teaching students, it is two-way. You teach the students and the students teach you. 15 years of teaching of physiotherapy students on neurology has taught me a lot. Whether I have taught them anything, I'm not sure. But I have learned a lot of things from my physiotherapy students. The first question, the first day, first hour I spend with the students, I don't talk subject, but I ask them the question, why have you chosen physiotherapy? You get a lot of funny answers. The commonest but depressing answer is, medical curriculum. And after all, dental could try curriculum. That kind of attitude is very bad. First day itself, I tell them, physiotherapy is not like doctor's job. It's more than that. It is definitely more than that. So first motivation is that physiotherapy is more than a doctor's job. Second reason they say why they have selected physiotherapy. When they current I mean, talking about 15 years ago, no, it's not so. There are a lot of competition. Any amount of heat therapy, any amount of wax therapy doesn't help. So then I tell them, never do that. This doesn't end there. There is one part in physiotherapy known as MRC graded. Usually physiotherapy students miss that. Skip in choice. That is, every muscle you are supposed to assess whether it is weak or strong. Then I tell them, all physiotherapy, you become a physiotherapist, you are my physiotherapist. I know all of them, they are all my students. I have to choose which physiotherapist I must send my patient. I will see which man can do MRC grading. He is the best physiotherapist. So the motivation is to learn whatever you have chosen the field and then attain maximum possible knowledge and then dissipate it to the society. That's what they are doing, Drona, supreme teacher. So first congratulate them on their name and the concept of teaching rather than making money out of these instruments. That's what we need. Without money nothing happens, nothing moves. Secondly, dealing with special children, as Radhajan said, it's very difficult. It's a teamwork. You need a pediatrician. Even before that, you need a gynecologist who must give you the history, what happened when the child was born, whether the child cried immediately, what was the blood score, all the things. And then comes pediatrician, then comes neurologist, and then physiotherapy, occupational therapy, speech therapy, dietitian, social worker. And then added to this, they should have a battery of doctors like psychiatrists, orthopedic surgeon for rehabilitation, rehabilitative surgeries. So it's not a simple one-man show. It's a teamwork. And I am sure you are going to have everybody here to manage all these special children. Usual question, when a child, mentally retarded child or a hyperactive child comes, the mother comes and asks you, that kind of question they always ask. The answer is very simple. God chooses parents who are tender, very affectionate, who will take care of you well. So such special children are given to those parents who are special parents. Not only the children are special, the parents are special. And so they are given, these children are given to these parents. They don't give it to somebody who will not take care of the child. So that is the explanation. So to that extent, that kind of attitude towards the special children, if you can offer, I think you would have achieved your aim. And then regarding the other equipment for physiotherapy, others, stroke patients, the longevity has increased now. Now we have more old people because there was a time when people used to die around 45, 50. Now the expected age is going beyond 65. Then when you have more people with 70 years, 80 years, you are going to have a lot of dementia, a lot of strokes, a lot of arthritis, a lot of rehabilitative conditions we are going to have. So more than the doctors, you should have more rehabilitative people, personnel, like physiotherapists, occupational therapists like that. So this is a nice center, everything under one roof. You have physiotherapy, you have occupational therapy. For those who do not understand the difference between physiotherapy and occupational therapy, both are essential. I would even say occupational therapy is more sophisticated and difficult. Physiotherapy is to improve the power, whatever the capacity they have. Occupational therapy is making use of the power that the physiotherapists have developed. With the existing possibility, how can they live a normal, more or less normal day-to-day life? So both are essential. You should have occupational therapists too. And of course, the rare commodity in our specialty is speech therapists. We are not getting speech therapists at all. It's very difficult to get a speech therapist. So you should have a regular speech therapist. Speech therapy is the most important thing as far as the right-sided stroke is concerned. They are more worried. It itself is a huge, big subject, speech therapy. So I request you to have a speech therapist. And the final request is, most of the patients who come for rehabilitation may not be able to come here to your center. At least about 25% of them. So you have people who can go and attend them at home. You bring the people who are taking care of the sick people at home here, teach them how they should arrange the room, how they should have all the facilities for the person who is requiring rehabilitation, and then your person should go there and teach them, so that it's a two-way. The teaching grown on, then it becomes complete. You should teach them, the people at home, and then you give them physiotherapy, all right. You make them come here after some time. So the initial phase, I think the teaching is important. I'm really very happy to be a part of this function. I'm a little greedy. I don't want to be only part of this function. I want to be part of your center. Sure. So whenever you need my assistance or help, I think I'm ready to come here and help.